Hi, welcome to my group's video presentation. Our title in this assignment is Leptospirosis. Here I introduce to you my group mates, Sushan, Wanxin, Ariel, Fatin, Tiffany, and myself, Yijing. Leptospirosis, also known as rat urine disease as it is commonly associated with rats. First case of leptospirosis in human was in the year 1925 in Malaysia. The pathogen causing the infection is Leptospira interrogans. Infection occurs through direct contact with infected animals or their urine. It is called zoonosis because it is transmitted from animals to humans. Main animal reservoir is rodents, specifically rats, other than dogs, rabbits, birds, and more. Leptospirosis is presumed to be the most widespread zoonosis in the world, with incidence higher in warm climate countries with high rainfall than in temperate regions. The disease is seasonal, occurring the most in summer or fall. Those are the three exposures contribute to getting the infection, and in Malaysia, most cases are linked to visiting waterfalls. These are the estimation of the cases occurring worldwide annually, and there are 86 outbreaks and 30 death cases in Malaysia as of 2016.
So leptospirosis can be transmitted to humans through cuts and abrasions of the skin or through the mucous membrane of the eyes, nose, and mouth with contaminated water. An individual can be infected when in contact with infected organisms, via infected urine or contaminated media such as food or animal bedding. Other than that, it is also considered as an occupational hazard for people who work outdoors, such as farmers and animal caretakers. This disease has also been associated with recreational activities, such as kayaking, and it can also be due to household exposure, such as dogs and domesticated livestock. So moving on to pathogenesis, leptospirus invade the body after penetrating exposed mucous membranes or damaged skin. After an incubation period of 4 to 20 days, leptospirus circulate in the blood and replicate in many tissues including the liver, lungs, and central nervous system for 7 to 10 days. Damaged organs may take some time to return to normal function after treatment. However, in some cases, severely damaged organs may not recover, leading to chronic disease or death. Despite clearance from the blood, leptospirus may remain in immunologically privileged sites, including the eye, for weeks to months. So most of the serotypes have the same pathogenic mechanism, and they are associated with particular animals. For example, L. pulmonar and L. interrogans are seen in cattle and pigs, while L. canicola is associated with dogs. Several candidate virulence factors have been identified that might contribute to the pathogenesis of Leptospira infection. So one of the virulence factors is hemolysins, which lyse red blood cells and other membranes. Another one is adhesion molecules, which helps leptospirus to attach to host cells in order to penetrate, disseminate, and persist in mammalian host tissues. Other virulence factors also include lipopolysaccharide and outer membrane protein.
Let's get right to the signs and symptoms. Okay, generally, leptospirosis can be associated with high and above fever, headache, chills, muscle aches, muscle stiffness, vomiting, abdominal pain, diarrhea, rashes, red eyes, and even jaundice. There are two phases of leptospirosis. After the first phase, the patient may recover for a time, but may develop the symptoms again in an immune-mediated phase. If a second phase occurs, it is more severe and the person may actually have jaundice, kidney or liver failure, or even meningitis, irregular heartbeat, lung problems, red eyes. This phase is also known as real disease.
It is usually diagnosed by the detection of antibodies by culturing bacteria from blood, urine, or tissues, or by demonstrating the presence of Leptospira using the antibodies labeled with fluorescent markers. Other diagnoses are PCR and immunostaining. Next, microscopic agglutination tests can also be used to detect the Leptospira. ELISA is operated based on the genus-specific antigen. It has the weak cross-reaction due to the presence of other diseases may be observed. In dark field microscopy, Leptospira are observed as thin coiled moving microorganisms. It is also technically demanding. Basically, the examples of prevention are do not swimming in water that are contaminated with animal urine, wear protective clothing, and provide animal vaccine for pets.
Lastly, we'll go into some discussion about our topic leptospirosis. So, are the preventive measures good enough? It is good, but more can be done. For example, additional steps should be taken such as filtering and disinfecting water with chlorine and iodine before consumption, especially in rural areas. Also, people traveling in the endemic areas can consider taking doxycycline supplemental. Next, what worked and what did not? Well, although appropriate protective clothing is important, it is however not enough as these tiny spirochetes can easily go through clothing and come in contact to open wounds or abrasion on skin. Thus, clothing does not totally prevent leptospirosis. What else can be done? Well, further research should be explored as the pathogenesis is still not entirely understood. Also, the government plays an important role in educating the people who live in areas that has rampant cases of leptospirosis. Therefore, the government has to fulfill its responsibilities to raise awareness among the public. Is the current diagnosis method good enough? Are there any other methods? Our answer to that is the microscopic agglutination test is still one of the best known methods to date. This method is very specific for serial diagnosis of leptospirosis, and it uses live samples that is freshly isolated from patient as well.
In summary, leptospirosis is not a new disease in Malaysia, but has been around since 1925. Its recurrence in the recent years proves to be a source for concern. Therefore, the Malaysian government should continue to work out measures to tackle this infection so that its incidence does not continue to rise. Although there are antibacterial treatments available, there is yet to be a vaccine available for prophylaxis treatment of leptospirosis in humans. So it is essential for the general public to be informed of steps to take to prevent the spread of leptospirosis in the country.